The materials needed include a number 151 forceps, periosteal elevator, straight elevator, anterior ash forceps, tissue forceps, scissors, chromic gut suture, and a needle holder. Here we have the mandible of a cow. So this is the lingual side, and this is the facial or buccal side. And after anesthetizing the patient, we'll start with the periosteal elevator, which, as you can see, has a sharp end and a round end. We are going to use the sharp end first to separate the gums from the tooth and the underlying bone, as you can see here. Please be careful when handling this instrument in order to avoid slipping and possibly striking your fingers or the patient's mouth. After using the sharp end of the elevator, you may switch to the round end in order to separate a larger area of tissue. Continue to separate tissue on all sides of the tooth. Next, we are going to use the straight elevator. Make sure to place the concave side facing the tooth that you are extracting. You should always place the straight elevator from the buccal or facial side of the tooth, either distal or mesial. Never use the straight elevator from the lingual side. Start to luxate the tooth. Keep the straight elevator in the previously established purchase point and begin to rotate it towards the tooth you are extracting. Next, we're going to use the ash forceps. Make sure to place the forceps first on the lingual side of the tooth, then on the facial. And also make sure that the forceps are seated as apically or downward as possible in order to avoid fracturing the crown of the tooth. Begin by rotating in a buccal lingual direction, and then you may rotate in other directions as well. You can also use the 151 forceps, which is the universal lower forceps, to extract this tooth. Continue to move and rotate the tooth until it is removed from its socket. Congratulations. With the help of your partner, hold the tissue with the tissue forceps and drive the needle through the buccal tissue. Pull the suture out and insert it again through the lingual tissue at approximately the same depth as the first one. Pull the needle out until you have about a third of the length of the suture material left at the end. Then, using your fingers, you're going to wrap the suture around the needle holder twice, grab the tail, then pull the needle holder through with one hand and the other end with your hand to make the knot. Then, using your fingers, you're going to wrap the suture around the needle holder twice, grab the tail with the needle holder, and pull this through while holding the other end of the suture material with your other hand to make the knot. Then take the scissors and cut both ends of the suture material close to the knot so that approximately a few millimeters of suture material is left. Try to keep the knot to one side of the socket instead of directly over the socket. Congratulations.